Do prostatic cysts raise PSA levels? Imagine discovering a cyst inside your prostate and wondering if it could be affecting your blood test results. Prostatic cysts are fluid-filled sacs that develop within the prostate gland. They are usually benign, meaning they are not cancerous and often don't cause symptoms. But can they influence your prostate-specific antigen levels, which are commonly used to screen for prostate issues? The answer is yes, but with some important nuances. Prostatic cysts can sometimes be associated with elevated PSA levels, but this is not always the case. PSA is a protein produced by prostate cells, and its levels in the blood can rise due to various reasons. These include prostate cancer, inflammation or infection of the prostate, benign prostatic enlargement, or even trauma. When it comes to cysts, especially large or hemorrhagic ones, they can sometimes cause a noticeable increase in PSA levels. Large cysts, or those that bleed into the cyst cavity, known as hemorrhagic cysts, can irritate or inflame surrounding prostate tissue. This irritation can lead to a rise in PSA levels. For example, there have been reports of benign large prostatic cysts causing PSA levels as high as 79 nanograms per milliliter, which is well above the normal upper limit of about 4 nanograms per milliliter. Hemorrhagic cysts, which involve bleeding within the cyst, have also been linked to elevated PSA, likely due to inflammation, bleeding, or tissue irritation caused by the bleeding. It's important to understand that very high PSA levels often raise suspicion for prostate cancer. However, in cases where a cyst is present, the elevated PSA might not mean cancer. Sometimes, a cyst can cause a significant PSA increase without any malignancy. Nevertheless, the presence of a cyst along with high PSA levels warrants further investigation. Doctors may recommend imaging studies like ultrasound or MRI, and sometimes a biopsy, to rule out or confirm prostate cancer. From a medical perspective, while prostatic cysts can cause PSA levels to go up, the increase is usually less dramatic than what is seen with prostate cancer. The overlap in PSA levels means that a high PSA in the presence of a cyst should not be automatically assumed to be cancer. Instead, it should prompt a thorough evaluation to determine the cause. This is because PSA is a sensitive marker but not a specific one, meaning it can be elevated for many reasons. In summary, prostatic cysts, especially large or hemorrhagic ones, can sometimes raise PSA levels, but this elevation is generally less than what is seen with prostate cancer. If you have a cyst and your PSA is high, your healthcare provider will likely recommend additional tests to check for cancer or other prostate issues. Remember, PSA levels alone cannot tell the whole story. Proper diagnosis involves considering your medical history, imaging results, and possibly tissue sampling. Always consult your healthcare professional for personalized advice and assessment.